Hi, good evening. I am Famibere. Welcome to another conversation with me. Today, our topic is syphilis. A brief introduction. Syphilis is an STI caused by the bacteria called Treponema pallidum. It is mainly spread through sexual contact, but can also be spread from a pregnant mother to the baby. If untreated, it can cause severe and serious damage to multi and different organs in the body. A brief introduction. Syphilis has been known since the late 15th century, especially with a major outbreak in Europe. It was called the Great Pox before the inception of antibiotics. Syphilis disease was devastating before penicillin was introduced in 1940. Under signs and symptoms, syphilis occurs in various stages. We have the primary stage, the secondary stage, the latent stage, and the tertiary stage. These stages have their different symptoms and signs. For the primary phase, you would observe a single painless sore at the site of the infection that goes off on its own in a few weeks. For the secondary stage, you'd observe skin rash, swollen lymph nodes, mouth sores, fever, hair loss in some cases. For the latent stage, there are no visible symptoms, but the bacteria is still very much present in the body. For the tertiary stage, this is the final stage of the syphilis infection and can occur years later. It is characterized by major organ damage like severe heart disease, brain damage, blindness, and even in some extreme cases, death. In babies, symptoms can be bone deformities, developmental delays for newborns, and also in some extreme cases, stillbirths. Under diagnosis, here we explore the VDRL testing, which is the Venereal Disease Research Lab testing. We can also explore the PCR testing and also explore some major antibody testing to detect the bacteria causing syphilis present in the sores. We can also explore in pregnant women that it is recommended for regular routine syphilis testing to avoid factors that cause deformities and major stillbirth crises for pregnant mothers that transfer this syphilis disease to their newborn. Under physical examination, we look out for rashes or mucus patches. We also look out to check for the lymph nodes. We also look out to perform neurological exams in suspected latent stages. Remember that the latent stage doesn't come with any symptom. So even if there is no symptom, look out for neurological signs. Also, you have to examine the genitals, the anus, the mouth, and the skin to check out for skin lesions present in the body. In summary, the clinical presentations are phased into three different stages: the early stage, the secondary stage, and the late stage. The early stage characterized with a painless sore on the genitals, on the mouth, and enlarged lymph nodes. The secondary stage is characterized with sores, usually on the palm and on the soles of the feet. Also, you can experience fever, fatigue, sore throats, amongst other mild symptoms. Then for the late phase, we explore a wide range of neurological, cardiovascular, like memory loss, difficulty in walking, and heart murmurs. Under differential diagnosis, here we are talking about ailments and diseases that mimic the syphilis bacterial infection. Here, we talk about herpes, which is characterized with painful blisters. Meanwhile, in syphilis, we have painless sores. Also, we explore HIV because of the fatigue and fever that comes with it. We also explore drug eruptions because of the rashes that comes with taking some medications. Also, we talk about psoriasis because psoriasis has the characteristics of having rash, but the rash is totally different from the syphilis sore. The key difference here are painless sore and a positive blood test for syphilis confirms the syphilis disease. Under etiology, here we explore the causes and the risk factors. For the causes, it has been established that the bacteria causing syphilis is the Treponema pallidum. Under risk factors, we explore unprotected sex, multiple sexual partner, men-to-men sex, HIV infection, contact with the syphilis sores, and also risk of terminating babies in pregnant women. For treatment, we explore the use of antibiotics. In this, we use the penicillin G antibiotics for the treatment of syphilis. We talk about the use of single dose for the early stage and multiple dose for the other stages. Also, the use of oral doxycycline for penicillin allergy. However, doxycycline is not to be used in pregnant women. We also explore a management, that is, follow-up blood test after treatment with antibiotics. It's very important to note that sexual partners are supposed to be notified and treated after you have been treated of the syphilis infection. Under prognosis, here it's very important to note that it is excellent that syphilis is treated early. This can guarantee full recovery and little or no complications. However, once it has progressed to the late stage, every end organ damage that has already been done cannot be reversed. It's very important to note that syphilis infection is to be treated early. If treated early, there are little or no complications and complete full recovery is promised. However, if left untreated, it could lead to severe organ damage like blindness and even a major neurological effect, brain damage. It could also lead to deformities in kids, stillbirth, and even death of adults. Yes, syphilis can actually go down that way. Sexual partners treatment is very important to avoid reinfection of the syphilis bacteria. Thank you so much for listening. I remain Famibere. See you in the next video. Bye.